Imagine this. It's 3 a.m., middle of the night, and you get that call of nature. You stumble out of bed, head to the bathroom, right? Like millions of people over 65 do every single night. But here's the really surprising thing we found. That seemingly simple trip. It could be dramatically increasing your risk of a stroke.
Mm-hmm.
And the research, well, it's truly eye-opening. Johns Hopkins University recently found certain bathroom habits can boost stroke risk by, get this, over 300% for adults over 65.
Wow.
Yeah, that's a threefold increase.
And what's really striking is just how common this whole issue is. You know, there was this big 7-year study, Cardiovascular Institute of California.
Mm-hmm.
They tracked 15,000 adults over 65. And they found one habit, something that like 89% of seniors do, was the most dangerous.
89%, that's almost everyone.
Exactly. And during this habit, they saw blood pressure spiking up to 180 over 110.
Oof, that's high.
That is really high. It puts immense strain on your blood vessels. It's definitely stroke territory.
Okay, so our mission today in this deep dive is to unpack 5 of these critical, maybe hidden bathroom habits, the ones that could be putting lives at risk. And we'll reveal the surprising number 1 danger. Let's do it.
Yeah.
So first up, number 5. This is something maybe a bit unspoken. Holding your breath while straining on the toilet.
Right. And lots of people deal with constipation, you know? So when you hold your breath and push hard, that's what doctors call the Valsalva Maneuver. You're basically trapping blood. You squeeze your heart, squeeze your blood vessels, and that causes these sudden, really extreme spikes in blood pressure.
Yeah.
There was actually a study in Taiwan, 2,000 stroke patients. Nearly 22%, almost a quarter, had their stroke event right on the toilet or immediately after.
Yeah, 22%.
Yeah. And people who chronically strain, they were twice as likely to suffer an ischemic stroke, that's the clot kind.
Right.
Plus, it can even trigger arrhythmias, you know, irregular heartbeats, which are major risk factors themselves.
So the key insight here is smooth movements are crucial.
Exactly, preventing those dangerous pressure spikes. So staying hydrated, eating fiber, it isn't just about comfort. It's actually direct stroke prevention.
Makes sense. Okay, let's move to number 4, shifting from internal to external factors. Taking really scalding hot showers. Feels great, maybe, but what's the impact, especially as we age?
Well, when you hit that very hot water, your blood vessels dilate, they widen pretty significantly and quite fast, and your heart has to pump much faster to keep up, to compensate.
Okay.
University of Tokyo did a huge study. 30,000 people followed for 20 years.
Wow.
They found that people regularly taking baths or showers above 104 Fahrenheit, they had a 26% higher risk of cardiovascular events, strokes included.
26% higher risk just from hot water.
Yep. And for older adults, it's particularly risky because our vessels get less elastic, you know, maybe some plaque buildup. That rapid change is dangerous.
So simple fixes then.
Pretty simple. Keep the water temp at or below 100 Fahrenheit, maybe start lukewarm, and try to limit those really hot showers, maybe 10 minutes max.
Good advice. Okay, from the shower to another really common habit, number 3. Sitting on the toilet for too long. It's especially, scrolling on your phone or reading a magazine. I think many of us might be guilty of that one sometimes.
Oh, definitely. And it's surprisingly risky. You see, sitting for too long slows your circulation right down. Blood can pool in your legs and your pelvis.
Right.
And if you're hunched over looking at a device, blood flow to your brain can actually decrease too.
Huh. Didn't think about that.
Yeah. And a UK study, this one had over 13,000 seniors, found that spending more than 10 minutes on the toilet regularly meant a 37% higher risk of cardiovascular events, including stroke.
37%. Why is that?
Well, the thinking is it could increase the potential for small clots to form because of that sluggish blood flow. Plus that hunched posture, it can raise blood pressure itself.
Okay.
And maybe less obvious, the blue light from your phone screen disrupts relaxation, especially if it's at night.
Right. So the takeaway, keep
Yeah.
those visits short, leave the phone outside.
Exactly. Keep it brief, keep it focused. Stay hydrated too. That helps things move along.
Okay, number 2. This one involves movement, or lack thereof maybe. Getting up too quickly after sitting or lying down. This feels like more than just getting a bit dizzy for a second.
It definitely is. It's called orthostatic hypotension. Basically, a sudden drop in blood pressure when you stand up fast. As we age, our blood vessels stiffen, they don't react as quickly. So for a moment, the brain might not get enough oxygen.
And that leads to higher risk.
Yes. Cleveland Clinic research shows older adults who frequently experience this dizziness have up to a 40% higher risk of stroke and heart attack.
40%? That's significant.
It is, and it hugely increases your fall risk, too.
Hmm.
The CDC says nearly 80% of bathroom falls for people over 65 happen this way.
And falls can cause strokes.
Absolutely. Head trauma from a fall can directly trigger a hemorrhagic stroke, the bleeding kind.
Okay, so what's the fix? Slow down.
Exactly. Stand up slowly, mindfully. Maybe pause for a second when you get up. Take a couple of deep breaths. Rise gradually. If it happens a lot, definitely talk to your doctor.
Right, good advice. And that brings us to number 1, the top hidden danger in the bathroom for people over 65. What is it? It's rushing to the bathroom, which often leads to a fall.
Yes, this is critical, especially at night. You've got that urgency. Maybe you're groggy, the lighting isn't great, you're unsteady. It's just a perfect storm for a fall.
And that sudden rush connects back to the dizziness thing, too.
It does. That sudden movement can trigger orthostatic hypotension again, making a fall even more likely. And remember that CDC stat, over 80% of senior falls are in or right near the bathroom.
And the link to stroke is direct with falls.
Very direct. Head injuries from falls are a major cause of strokes, either hemorrhagic from bleeding or even ischemic if a clot forms due to trauma. And this risk is magnified if you're taking blood thinners. There was a 2020 study at JAMBA Neurology that found seniors who fell specifically because they were rushing to the bathroom at night. They were 2.5 times more likely to have a stroke within the next month.
2.5 times more likely. That's huge. So the fix here is absolutely crucial. Never rush. That's the main thing.
Absolutely, never rush. When you wake up needing to go, sit on the edge of your bed for just a moment. Let yourself adjust.
Okay.
Use a nightlight, always. Make sure the path is totally clear. No rugs to trip on.
Good point.
And if you use a cane or a walker, use it for that trip too. Non-slip socks can also be a great help on tile floors.
Yeah.
And if urgency is a frequent issue, talk to your doctor about managing that. But the key is just taking your time. It drastically cuts the risk.
It really is quite remarkable, isn't it, how these completely ordinary everyday habits can carry such significant hidden dangers. But like we've talked about, making these simple conscious changes, slowing down, being mindful, can make a powerful difference in lowering your stroke risk. It really empowers you to take control.
It really does. And considering these, well, quite surprising insights about just the bathroom, it kind of raises a bigger question for you, the listener. What other seemingly insignificant daily routines or maybe environments in your life might be silently impacting your health, and how might you start to think differently about them?